Where does SI joint pain radiate? SI joint pain can oftentimes radiate to certain aspects of the hip, to the lower back, and even upwards a little bit. Now, an important consideration when we're talking about radiation and if it's from the SI joint or not is that the knee is a pretty clear division. Now, if this symptoms, if numbness, tingling, or burning types of sensations are created, a lot of times this is not from the SI joint only. The SI joint might be a part of it. However, there's a part nerve involvement. Typically, these types of presentations have a nerve-based aspect to it, but it doesn't mean the SI joint is not a driving factor to this. Now, the knee being the division is anything that's below the knee, such as calf, foot, arch, numbness, and even pain into that area, especially if it feels like it's connected to the SI joint, is not purely from the SI joint. This is going to be from a nerve root or something affecting a nerve root, all right? Now, SI joint pain alone or SI joint dysfunction alone can typically radiate closely to it. Now, if I bring this model up here, so here's the SI joint right in there, is that we can typically feel it radiate upwards here into the lower back area, even outwards a little bit, kind of around like where you would think your kidneys would go, and usually around this area, all right? So here's the front of the body. It's going to go around the sides. So it'll almost seem like trochanteric bursitis. It'll almost seem like groin pain or FAI or hip impingement or a hip flexor. So a lot of these things can create radiation around the front and a little bit down into the groin. So remember that the divider is the knee and also how it feels. If it feels like an ache, it could be SI joint pain and it radiates downward. However, if we're looking at change of sensation, numbness or tingling, burning, shooting, these are typically nerve-based problems or qualifications, and in that case, we just have to treat this thing like a nerve-based problem first, and then we just go on to the SI joint at the same time. So they both can be typically remedied. Now, we're in Huntington Beach, California. I'm Sebastian at Performance Play Sports Care. We do offer to help people virtually and get them to the right point, all right? If you're not in an area where you feel like you have really good care or you feel like you've exhausted your resources, we're here to help too. So click on the link below, just reach out to us, let us know what questions you have, and we'll do our best to send you to the direction of where you can get that help. We'll talk to you soon.